Hey y'all, today we're going to talk about antibiotic use in the cattle industry. So, we all know what they are, antibiotics, right? You've gone to the doctor, you've gotten antibiotics, and when you get sick, really specifically a bacterial infection, and we'll get to that in a second. So, they are a form of treatment given to an animal to reduce or eliminate the presence of a specific or non-specific microbe. And usually that is all should be different bacterias. And bactericidal, there's two different forms. There's bactericidal and there's bacteriostatic. The cidal one kills them, and the static one just slows their growth, and that's in the name, static, to stop. And that antibiotics do not directly affect certain other microbes, such as viruses. And take note that I said directly. Sometimes, as we've learned, if you affect in the body the microbiome, a lot of bacteria and fungi and this depend on each other to grow in their own rates and in their own niches. And so if you kill one, there might be another bacteria that is dependent on that bacteria, and you will indirectly affect that other one as well. And they come in lots of forms. They come in pills, injectables. You can put it straight into the feed, and even more. So how are they used in livestock industry? They are essential for efficient production, but also the welfare of animals. Because as we all know, as we've all felt, when you get sick, you feel, it's stressful, it hurts, and you don't feel like getting up, right? So they simply treat bacterial infections, which can be stressful and even painful, such as in foot rot. As you can see in the top left picture over here, right here, obviously you can see her right leg. I think it's right. Yeah, it should be right. Yeah. Right leg is obviously normal. She's standing on it, nice and thin, and exactly how it's supposed to look. Versus her left leg is swollen. She's lifting it off the ground. She's not wanting to step on it. It hurts. So common things they're used for bovine respiratory disease, and that's one of the ones that accounts for huge losses in the industry, especially when the cows get to the feedlots, where you have mixings of cattle from different operations, and you get all kinds of different pathogens being introduced to different populations, and it is just accessible for infections. And mastitis, which is really big in the dairy industry, obviously. Metritis, calf scours, foot rot, as I said, and pneumonia. And over here you can see this cow is being treated for pink eye, and she's getting some antibiotics injected into her eye. And afterwards, they'll probably put a patch on her so that she doesn't get any sunlight into her eye. So what are some other uses of it? So they improve carcass quality, they increase economics, they increase profitability for producers wherever they are in terms of the supply chain, and they increase human public health. They help the human public health by reducing the presence of bacteria and infection in the beef supply chain, and that could be in lots of different ways. That could be in the dairy, that can be in as if you ever opened up a can of milk and you smell it and it's been old and it smells really bad, that's because the bacteria are in there. And also in the beef, as you can see in this picture right here, as in beef, sometimes in certain injection sites, if it's not a clean injection site and you infected it, then you can get an infection in the meat itself, and you'll sometimes get these huge things of pus inside of the meat. And that has to do with improving the carcass quality. So how do they increase production exactly, right? So they make you feel better, sure, and we don't really think about in human perspective how they would increase production. But when you think about cattle and what an antibiotic would do for them, what it essentially does is when there's an infection, there's more energy is allocated towards fighting the bacteria rather than towards growth and production, and you would see direct results in your average daily gain, and I'll get to that in a minute. But so some of the things that happens is your immune system is being taxed. It's your body is using your white blood cell, or the cow's body is using white blood cells and macrophages and all these different things to fight off the infection. And they get lethargic and they don't want to eat anymore, and they're just gonna sit around rather than walk around and all that good stuff. And also, again, to hit on it one more time, sometimes you get presence of pus in meat from infected injection sites. And obviously the best thing to do about this is to be a good producer and make sure your needles are clean, make sure where you're going is clean before you stab them or prick them. And also some of the performance values that are affected are feed intake because they're lethargic, they don't want to eat, they don't feel good, and a direct result of that is they have lower average daily gain. Your reproductive values are lower, especially if it's metritis. That's an inflammation or infection within the uterus. Your profitability is reduced, your dressing percentage is reduced, and more. So, consumer perception. I know antibiotics are a huge thing in the perception for what kind of beef you want to go get. In the stores you always see no antibiotics used on this cow or on this beef. So many of the things done in the industry are dictated by consumer perception. Of course they are, because demand for the product is necessary, and if the demand shifts, the industry's supply must shift to match it, or else you're not going to make any money. You need to sell to your consumers. You're making a product at the end of the day. It's a business. And it is in your interest to meet their needs as best as you can. This means it is imperative that consumers want the beef. And the way you can do that, one of the best ways you can do that is to have transparency. As you can see in this great GIF I have right here. And a few ways that you can do that is, this is my own opinion at this point, but a really good way to do that without much of a cost and money is to have a social media account. People are on Instagram, Facebook, and if you have a really nice marketable farm that you could put on there, that'd be great, and that would increase your profits probably. So how antibiotics and their effect on food safety. So the fear of antibiotics is reasonable. Of course it should be, right? We do not want antibiotics in our food, and we do not want to even give a chance for resistance to occur, whether it be through agriculture, through livestock, through hospitals, or wherever it is. So, however, it is important to remember that specifically in the livestock industry that there are standards in place that do not allow antibiotics in beef products, because there are certain withdrawal periods for each antibiotic, and beef cannot be sold until that animal has had the time to flush out of their system. And those standards are set by the FDA. Not the FDA, the USDA. Ooh, might be both. They definitely both of them play a role, and FDA is the one who sets the withdrawal periods. And also, in addition, there's this one study that found the occurrence of antimicrobial resistance did not differ between cattle that were exposed to antibiotics and then between cattle that had no antibiotics. So it's more complex and has more antibiotic resistance has more to play than what we would think. And if you can look over here, you can see the different withdrawal times for a bunch of these different injectable antibiotics that you can give. You can see one that you would obviously recognize, penicillin. You go over here, you see a bunch of concentrations and dosages and where you should administer it to help avoid injectable lesions sometimes. Sometimes there's certain routes of administrations that are better. But right here it says 6 days. So if you give a penicillin shot to a cow, that cow cannot be sold for beef for 6 days. And that's my references. Thank you.